Thanks very much for coming to this COVID-19 desktop scenario of a school outbreak. This scenario has been prepared by the Infectious Disease Epidemiology team at the Vermont Department of Health. Here is a brief outline of today's presentation. As of September 9th, Vermont had a cumulative total of 1,661 confirmed cases of COVID-19 and 58 deaths. The peak daily number of new cases took place at the beginning of April. In the past 2 weeks, most counties in Vermont had fewer than 1 or 2 new cases per day. 8 counties had 3 or fewer cases total. As of September 9th, there have been a total of 62 cases in children under 10 and 145 cases in children aged 10 to 19. Of the 58 deaths in Vermont, none were in people under 30 years old, 13 were in people aged 30 to 69, and the remaining 45 were in people aged 70 and older. As we know, and as was stated in the Vermont Strong and Healthy Start guidance and in guidance provided by the CDC, schools play a unique and critical role in our communities. Overall, the people of Vermont have done extremely well controlling the epidemic within the state, and because of this, we are fortunate to be able to reopen our schools this fall. This scenario is part of the guidance that has been developed by the Vermont Department of Health to help schools open safely and to help you address COVID-19 cases if and when they occur in your school. FEMA, the Federal Emergency Management Agency, describes 5 mission areas for emergency response: prevention, protection, mitigation, response, and recovery. This scenario is primarily intended to build capacity for response. A secondary goal is to enhance prevention. The objectives of this presentation are to assist participants in identifying salient COVID-19 risks in existing and planned school operations, to evaluate the school's response to a COVID-19 case, an outbreak in a school, to enable participants to quickly coordinate response operations with counterparts within the school or district and with the health department, and to enable internal and external partners to coordinate and deliver prompt and reliable information to the community through clear and consistent messaging. This scenario is a hypothetical event at an imaginary school. It is described as a primary school, but similar steps would take place at any other school setting. The entire presentation is expected to take approximately an hour and a half, including breaks to consider questions and to complete an exercise. At each slide with a yellow question mark, please pause the recording and consider your response before continuing. At the slide with the yellow pencil, please use your own materials to complete the activity. Please make sure that you have the following materials on hand for the exercise: paper and a pen or pencil for notes, a copy of the Health Department line list template for schools. The URL for this is at the end of this presentation. And school records to populate a line list of close contacts, seating charts, class schedules, staff movement, etc., etc. Questions are designed to prompt you to think about next steps and to think about whether you may wish to make changes at your own school. Schools have flexibility in how they implement the Strong and Healthy Start guidelines, and in many cases there is no single correct way to implement all the recommendations. The Department of Health will be happy to provide assistance as you navigate the guidance and make these decisions. And now, with sincere apologies to the TV show Law and Order. In a COVID-19 school outbreak, the people are represented by 2 separate groups: the students, staff, and families who experience the outbreak, and the school and health department staff who investigate and control it. These are their stories. Module 1 takes place during the second week in October, starting shortly after Indigenous Peoples Day. On Wednesday, October 14th, school nurse Beatrix Potter arrives at work at 6:30 a.m. as usual. Like many teachers and families in her community, Nurse Bia, as the children and teachers call her, was quite worried when school opened at the beginning of September. But all the worry and preparation paid off. Now, 5 weeks into the school year, Shel Silverstein Elementary has not had a single person with COVID-19 who attended school while infectious. The school implemented several strategies to minimize exposure. Children in grades K through 2 remain in the same classroom all day, with one teacher per pod of 10 to 15 students. Children in grades 3 through 5 also stay in one place with pods of 10 to 15 students, but each pod is paired with another, and 2 teachers rotate through to cover either science and math or English and social studies. Box lunches are delivered to the classroom at noon, and the day is interspersed with physical education, music, and art classes, which are held outdoors as much as possible. Last week, the school graduated from a hybrid learning model to a full 5-day in-person school week, and school life is starting to feel more normal. This week, the school held a special assembly outdoors on Monday in honor of Indigenous Peoples Day. Students and staff enjoyed having an opportunity to gather and celebrate while maintaining distance. As usual, Nurse Bia begins the day by checking her messages to see who reported illness or exposure in the daily health check submitted by parents and staff each morning. This morning is a bit busier than usual. There are 5 yes responses to the illness question from parents, 2 from teachers, and 1 from a custodian. Nurse Bia calls each family and staff member to find out more information and to make recommendations. Nurse Bia gathers the following information in her calls. Please consider, what do you think she should recommend to each of the parents and staff members? Feel free to pause the slide here if you would like additional time to consider your answers. This is what Nurse Bia observes and what she recommends. None of the children or adults have had any known exposures or have had high-risk travel in the past 14 days. None of the children or adults report new loss of taste or smell. 3 of the children report cough. 2, Anthony and Jimmy, are told to stay home and are referred to their medical providers for follow-up. The other, Kyle, has a long history of chronic asthma, which is currently well controlled. His asthma was previously diagnosed, and his symptoms today are typical of that condition, so he can come to school if he feels well enough to do so. 1 additional child, Lynn, and 1 adult, the custodian, report fever. Both are told to stay home, and both are referred to their medical providers. The other remaining child, Mary, has a clear runny nose. She was medically diagnosed with seasonal allergies in the past and has a treatment plan, which she is following. She can come to school today if she feels well enough to do so. 1 of the 2 remaining teachers, the art teacher, has multiple other symptoms. She is told to stay home and is referred to her medical provider for follow-up. The other remaining teacher, the 1st grade teacher, reports a migraine headache that feels typical to her. But she also has another symptom, nausea, which is less typical for her. She is told to stay home as well and is referred to her medical provider for follow-up. Question: do you agree with Nurse Bia's recommendations? Would you do anything differently? Why or why not? Again, please feel free to pause the recording here and consider your responses. The following questions are for your consideration. You may wish to take out your paper and pencil and take a few notes for things you would like to change in the future. Does your school have similar processes for minimizing exposure and for screening? Do you have enough staff to cover positions if some people are ill? Is there anything that you think should be adapted or changed? How should Nurse Bia decide when ill students and staff can safely return to school? The question of when students can return to school may be difficult for school nurses and COVID coordinators. The University of Vermont and the Health Department have developed a COVID-19 pediatric algorithm to assist with this. This algorithm may be updated in the future, and we've included the link at the end of this presentation in case you would like to bookmark it. The algorithm can be used in conjunction with the child's family and medical provider to determine when children can return to school. Here is page 2 of the Return to School algorithm. Back to our school. Families, some of which have been in line in the driveway since 6:45, start dropping off their children at the entrance at 7:15 a.m., and the school buses arrive shortly thereafter. 6 lines, organized by grade, are set up for the daily temperature screens. Children, who by now are familiar with the routine, stand 6 feet apart in line, wash their hands at the hand washing station before the temperature check, and have their temperatures checked by a screener who uses a non-contact thermometer. The screener washes hands before beginning and wears a mask, eye protection, and disposable gloves. 3 of the teaching assistants take turns doing the daily screenings. Nurse Bia uses this time to continue working with families and staff who have questions. If a parent fails to submit the results of the daily health check, a teaching assistant calls the parent while the child is waiting in line for the temperature check. The teaching assistant also provides masks to any children who arrive without one and makes sure that the masks are being worn properly. Lines are set up at the entrance closest to the child's classroom so that children can proceed directly to their rooms once they have been cleared. Question: what do you think of the daily temperature screening and entry process at Shel Silverstein Elementary? This is how this school has chosen to do it, but it isn't the only option. Would you do anything differently? If so, why? Does your school have a similar daily temperature screening and entry process in place? Is there anything that you think should be adapted or changed? Daily symptom and exposure screening and temperature checks are methods the school is using to try to identify infectious individuals and prevent them from entering the school. These are at the top of the hierarchy of controls proposed by NIOSH for workplace safety. In addition, Shel Silverstein is also implementing engineering controls to isolate people from the virus and administrative controls to change the way that students and staff interact and work. PPE, or personal protective equipment, is the last line of defense and used as necessary to protect students and staff from exposure to infectious materials or people. By 7:45 a.m., the school day is finally ready to begin. Now that school is back to a full 5-day in-person model, all common rooms have been converted into classrooms. Dividers have been set up in the cafeteria, gym, and library, and, as previously described, classes are taught in pods with no more than 10 to 15 students each. Desks are 3 to 6 feet apart. Students and staff are all expected to wear masks throughout the school day, except when they are eating lunch or snacks. Bathrooms are restricted by grade and class, and no more than 2 to 3 children are permitted in the bathroom at one time. Lunch is distributed in brown bags to all classrooms daily, and students eat at their desks. Some students are moved so that all are 6 feet apart for lunch. An industrial hygienist reviewed the school's airflow and HVAC systems before school started, and grant funding was used to upgrade HVAC filters and purchase several portable air cleaners. Windows are open throughout the building for now, although the weather is starting to turn cooler and teachers are beginning to close them. Daily cleaning routines have been established and include cleaning of spaces and surfaces used by multiple classes 3 times a day, especially bathrooms, door handles, and handrails, etc. Cleaning of playground equipment twice per day, and classroom and other cleaning at the end of the day. All cleaning products are from EPA's List N, disinfectants for use against SARS-CoV-2. Question: what do you think of the environmental and administrative controls at Shel Silverstein Elementary? Would you do anything differently? If so, why? Does your school have similar environmental and administrative controls in place? Is there anything that you think should be adapted or changed? Back to our school. Uh-oh. Noah N. becomes ill and vomits at his desk in Mr. Dahl's classroom. He appears feverish and starts to cough. What should Nurse Bia do next? Many of the symptoms of COVID-19 are also common in other childhood illnesses, like common cold, flu, or seasonal allergies. Follow your protocols for suspected cases of flu, norovirus, and other infections. Taking everyday actions to reduce the spread of these infections will also help reduce the potential spread of COVID-19. Additional information on infection control is also available in the Strong and Healthy Start guidance. If a student develops a fever or any of the symptoms asked about in screening, immediately ensure that they put on a mask if they are not already wearing one. Place them in an isolation area separate from staff and other students, and contact their parent or guardian to take them home immediately. Sick children should not ride the school bus. If a staff member develops symptoms throughout the day, they should go home immediately. In the midst of all this, please don't forget to be sensitive to the needs of the student when they are being brought to the isolation area. Ensure it is done in a non-threatening manner while explaining to them what is happening so that they understand. This can be a stressful and scary time. Once a person is sent to isolation, clean and disinfect all high-touch areas potentially used by the person no less than 1 hour after the sick individual has left the room. This may include the student's desk and chair, door handles, etc. Ensure safe and correct use and storage of cleaning and disinfection products. If possible, increase ventilation in the areas used by the person by opening outside doors and windows or using ventilation fans to increase air circulation. Always observe and enhance infection control. Universal precautions protect against many illnesses, not just COVID-19. But wait, what's wrong with this picture? She needs eye protection. Either a face shield or healthcare grade goggles will protect Nurse Bia's eyes. Full PPE, including an N95 respirator or surgical mask, eye protection, gown, and gloves, is needed if the child is known positive, if the child is symptomatic and known to be a close contact of a case, or if Nurse Bia is performing a nebulizer treatment. Not all PPE may be needed for all situations. Nursing professional judgment must always be used. Next morning. Thursday begins much the same as the previous day. At 11:15 a.m., Nurse Bia receives a call from Mrs. J, Jimmy's mother. After their discussion on the previous morning, Mrs. J took both Jimmy and her eldest son, Jeffrey, who had flown home from college last weekend, for COVID-19 tests. The clinic had just called with the results, both of which were positive. Mrs. J says that Jimmy, who stayed home again today, still has a runny nose and has developed a mild cough, but otherwise feels fine. Jimmy's brother Johnny, who is in 3rd grade, is in school today. What should Nurse Bia do next? What to do if there's a confirmed case of COVID-19? How will you know? You may be informed of a COVID-19 case in the following ways. The health department may contact you, or you may be informed by a parent or a staff member of a positive test result. Schools will only be informed about an individual with COVID-19 if they were in school while infectious. If someone tests positive for COVID-19 but was not in school while they were infectious, there are no additional steps necessary because others of the school were not at risk for COVID-19 exposure. The health department may work with you to determine if the person with COVID-19 was in your school while they were infectious. Note that there may be misinformation circulating and concerns about getting COVID-19. Remember to treat students and staff with respect and confidentiality. In most cases, someone with a new COVID-19 diagnosis is probably not going to be at school when this diagnosis is confirmed because they will already be quarantined at home due to illness or exposure. If the person with COVID-19 is at school, follow the same guidance above for what to do if someone becomes symptomatic at school. Mask, isolate, and go home. Close off any areas that the person with COVID-19 was in for more than 15 minutes until after cleaning and disinfecting. If possible, wait at least 24 hours after the infected person was in the area before cleaning and disinfecting. If 24 hours is not feasible, wait for as long as possible. Once again, increase ventilation in the areas used by the infected person by opening outside doors and windows or by using ventilation fans to increase air circulation. This is particularly important if you are unable to vacate and close off the room as previously described. If you have not already been contacted by the health department, the school administrator or COVID coordinator should call 802-863-7240 to review the situation and to determine next steps. If possible, the caller should be someone who can answer questions about the possibility of spread within the school. Begin to collect information to help build a line list. A line list is a document that lists all people who had contact with a sick person during their infectious period. Close contact means being within 6 feet of someone for more than 15 minutes while they were infectious. Someone is infectious starting 2 days prior to symptom onset, or for those without symptoms, 2 days before their positive test collection date. Contact tracing will use this list to follow up with exposed individuals, so it is important that the list be as comprehensive and as accurate as possible. Here is what happens next at Shel Silverstein Elementary. Nurse Bea informs the principal and Jimmy's teacher, Mrs. Alcott. Since it's a nice day, Mrs. Alcott's class spends the remainder of the day doing an art project outside at picnic tables in the fresh air. Nurse Bea calls Jimmy's parents and asks them to pick up his brother Johnny from school. Johnny waits in the isolation area until his parents arrive and then walks out to the car with Nurse Bea. Nurse Bea calls the Vermont Department of Health and notifies them of the diagnosis. Principal Milne activates the school task team and asks the assistant principal to collect documents needed to create the line list. Meanwhile, here's what's happening at the Department of Health. When we receive a positive COVID-19 test result, the health department initiates contact tracing. Contact tracers reach out to the person with a positive test result to provide guidance and to ask about symptoms, activities, and who they may have been in contact while they were infectious. They then reach out to people who had close contact to provide guidance on quarantine and testing. Contact tracers don't call people who have not had close contact with someone with COVID-19 while they were infectious. Contact tracers will assess the risk of transmission at all locations the person visited while infectious, including schools. Contact tracers notify the places where there was a risk of transmission. A team will work with these locations to assess the ongoing risk and to talk about next steps. The team may also make recommendations on who should get tested. Locations will not be notified if contact tracers did not identify a risk of transmission there. The team monitors the situation until the period of concern is over. Generally, this is 14 days when there is one person with COVID-19, or 28 days for outbreak situations. Jimmy's mother tells the investigator from the contact tracing team that Jimmy's symptoms first appeared on Tuesday night. This means that he was infectious beginning on Sunday. He was in school on Monday and Tuesday. She also tells the investigator that Jimmy's eldest brother, Jeffrey, had a test yesterday as well, and he is also infected. He had been in quarantine since his return from college over the weekend. Jeffrey feels guilty and seems depressed, and Mrs. J is concerned about his mental health. Mrs. J provides additional information about Jimmy's whereabouts during the infectious period and gives the investigator permission to contact the school and any identified contacts. The investigator advises Jimmy's mother about isolation for Jimmy and his eldest brother and about quarantine for exposed family members. He also provides information about mental health services and agrees to follow up with Jeffrey. The investigator will need to follow up with Jeffrey anyway, but he does not mention this to Mrs. J. A little later, Nurse Bea receives a return phone call from a public health nurse at the health department who sets up a meeting later that afternoon to talk with the Shel Silverstein Elementary's COVID-19 task team. At 3:30 p.m., right after the children have been picked up and buses have left for the day, the Shel Silverstein task team gathers online with the public health nurse and with other members of the health department rapid response team. These are the members of Shel Silverstein Elementary's COVID-19 task team. Nurse Bia serves as the COVID-19 coordinator. The team used the CDC's School Considerations, Readiness and Action Planning tool when planning to reopen and designated point people to lead in key areas. This is how this school chose to form a COVID-19 task team. All teams may not look the same. At the Department of Health, a new case in school will activate the Health Department's Rapid Response Team for school COVID-19 outbreaks, which includes maternal and child health, outbreak prevention and response, and contact tracing. Typically, you will work with a public health nurse and an investigator from contact tracing, and other members of the team are available to participate as needed. The public health nurse leads the call now and explains the information that the health department needs and the questions that they will ask. Identifying information about the person with COVID-19 will only be shared by the health department if consent has been given. The health department needs basic information about the case. What is the name, age, demographics of the person with COVID-19? Are they or were they symptomatic while they were at school? And when were they at school while they were infectious? The public health nurse also explains that an investigator from the contact tracing team called Jimmy's home that afternoon and spoke with his mother, who told the investigator that Jimmy's symptoms first appeared on Tuesday night and that he was in school on Monday and Tuesday. Mrs. J said that Jimmy rode the bus to school both days and that he and his brother Johnny carpooled home with the Smith families both days. Mrs. J gave the investigator permission to contact the school and any identified contacts. Notice that the nurse did not say anything about Jimmy's elder brother Jeffrey or how Jimmy may have become infected, to protect Jeffrey's privacy, because that information is not relevant to this response. The public health nurse wants to know the following. What steps have already been taken to notify potential contacts and stakeholders? Where in the school did the person with COVID-19 spend longer than 15 minutes while infectious? This could include classrooms, bathrooms, offices, gym, cafeteria, etc. Do you have a line list of people who have had close contact with the individual within 6 feet of the sick person for more than 15 minutes? This could include classmates, teachers, other staff, paraeducators, specialty class instructors, contractors, etc. Describe the layout of the spaces where the person with COVID-19 spent longer than 15 minutes. Facility maps or layout drawings are helpful. The following materials and information can be used to compile a line list of close contacts. Seating charts, class schedules, schedules of staff movement, bus seating charts, attendance records, activity participation records, etc. We will need the contact information for these close contacts, and we would also like to know if any of them have had symptoms. Okay, it's time for our activity. You are going to create a line list of close contacts. This is one of the most important things that you will need to do if someone was infectious while they were at school. Using the health department's line list for schools and your own school records, pick a random child and identify the child's close contacts over a 2-day period. Include anyone in the child's pod or classroom, anyone on the school bus who is seated within 6 feet, anyone riding in a shared car, and any other similar exposure, such as participation on a sports team or in an extracurricular activity. If you're unsure if the individual is a close contact, include them. It is easier to exclude individuals later than to add them. This is a preliminary tool for contact tracing. The more information we can gather with this tool, the more helpful it will be for the contact tracing team. However, if there is information that cannot be gathered, that is okay. This tool is really meant to supplement our contact tracing efforts. Please pause the presentation here so that you have time to complete the activity. Here are some additional questions now that you've completed the exercise. Were your school records sufficient to complete the task above? How difficult was it? Is there anything that you think you should adapt or change to make it easier to identify close contacts? Did you identify any gaps in your infection control practices based on reviewing these documents? Question: what should everyone do next? Here are the next steps for 4 different groups of people. The Department of Health will conduct contact tracing and consult with the school regarding whether to transition the school or classroom to remote learning. The school should notify parents, guardians, and staff that a person with COVID-19 has been identified. You should encourage them to answer calls from the health department and to participate in contact tracing. The school should also clean and disinfect all areas, such as offices, bathrooms, common areas, and shared equipment, including frequently touched surfaces. Please wait at least 24 hours before cleaning, if possible. The school should also consult with the health department regarding whether to transition the school or classroom to remote learning. Students and staff who have positive test results for COVID-19 should isolate, and students and staff who were in close contact with a person with COVID-19 should quarantine. Here is a template letter available on the Health Department website. This can be used to notify families and staff after you have identified that someone with COVID-19 was infectious while at school. It contains important information such as a request to respond to the health department if someone calls and ways to prevent the spread of COVID-19. It is very important to protect the privacy of the student and family. Please do not share the names of infected individuals. If someone is determined to be a close contact and needs to know, the health department will contact them. We'll pause here for another question. Shel Silverstein Elementary and the health department discuss whether to transition some or all of the school or classroom to remote learning. What would you advise? Explain your recommendations. Often in cases like this, there is no obvious right answer, and there are arguments to be made on different sides. The health department will make recommendations, but schools will make the final decision and may elect to be more conservative. Given that it was the end of the week, and given that Jimmy had a large number of close contacts in multiple settings, the school and the health department had agreed during the meeting on Thursday that it made sense to transition the entire school back to remote learning for one day while contact tracing was being completed. Community transmission had been going up as well, which was an added consideration. Nurse Bia and Secretary Seuss checked messages that morning. They see that there are 37 messages in the telephone's main account and 17 messages in Nurse Bia's account. There are over 50 emails from parents, students, and staff. At about 11:40 a.m., Jimmy's mother calls again to tell Nurse Bia that Jimmy's brother Johnny has also tested positive for the virus. The Shel Silverstein Elementary COVID-19 task team and the health department public health nurse have another meeting. The school provides another line list, this time for Johnny's contacts. By the end of the day, all close contacts have been identified and notified, and all are quarantined and undergoing symptom monitoring. Johnny has been diagnosed with COVID-19 but does not show any symptoms. His sample was taken on Thursday, and he is considered to have been infectious starting 2 days before that, so on Tuesday. Thus, he was infectious while at school from Tuesday through Thursday. In the early days of an outbreak, it's always good news when a day goes by without another new case. Module 2, the second week of this scenario, takes place during the 3rd week in October. On Sunday, head custodian, Mr. Dahl, supervises a team of staff to perform a deep clean of the entire school, focusing on the classrooms and bathrooms known to have been used by the 2 boys, but also including high-touch surfaces and other commonly used areas in the building. Consider, would you reopen school for in-person learning tomorrow? If so, would you reopen the entire school, Or would you continue remote learning for some classrooms? Explain your decisions. In an abundance of caution, Jimmy's and Johnny's classrooms remain in remote learning today. This is an informed decision on the part of the school, but it isn't necessarily the only answer. The health department will work with schools to evaluate the risk of different options. Close contacts continue to quarantine, and cases continue to isolate. The rest of the school goes back to in-person learning. Everyone seems more cautious today. Nurse Bia gets a call in the afternoon from another parent. Mr. Smith informs her that his wife, Mrs. Smith, was diagnosed that morning. The Smith children were already in quarantine after having been exposed, along with their mother, in the carpool last week, so Nurse Bia does not need to respond. This is Mrs. Smith. Jimmy's and Johnny's classrooms remain in remote learning on Tuesday since both teachers and several students were exposed and the school couldn't find substitute teachers. Close contacts continue to quarantine and cases continue to isolate. The rest of the school continues in-person education. Nurse Bia gets 3 calls today, 1 from a teacher and 2 from parents. Ms. Astrid Lindgren, Johnny's 3rd grade teacher, is infected. Her husband, who is immunosuppressed, has been staying in a hotel room since last Friday when she first went into quarantine. Melanie Miller was on the school bus with both Jimmy and Johnny while they were infectious. She sits in the seat closest to them and observed that Jimmy wasn't wearing a mask when he rode the bus last week. Little Fanny Franklin is also infected. She was in Jimmy's classroom and sits at the desk nearest to him. Neither of the children were in school during their infectious period, but Ms. Lindgren was there for one day, Thursday. She works with the health department investigator and with Nurse Bia to create a line list, which the health department uses for contact tracing. The only close contacts she identifies were in her classroom and are already quarantined due to their contact with Johnny. Ms. Lindgren reports spending her break time in the teacher's lounge several times last week. She isn't sure which days she was there, nor is she certain which other staff were there at the same time. She's in the habit of eating her lunch in the break room while reading a novel, and last week's book was particularly enthralling. Ms. Lindgren is an avid reader and once missed a plane while finishing Tolstoy's short story, Master and Man. By the end of the day, all new cases have been interviewed, all close contacts have been identified and notified, and all are quarantined and undergoing symptom monitoring. Do you have any concerns? If so, what would you do and why? Module 3 starts in the 4th week in October. On Wednesday, October 28th, about 2 weeks since the first case, the health department calls Nurse Bia to report that another teacher in the school has tested positive. Mr. Twain was a close contact of Ms. Lindgren in the teacher's lounge. The teacher's lounge should have been closed per Vermont guidance, but wasn't, and both of them had forgotten their contact with each other. Unfortunately, Mr. Twain worked with quite a few different teachers and pupils during the period when he was contagious. Here is an overview of the dates when COVID-19 infected students and staff attended school while contagious. 4 people, Jimmy and Johnny Jones, Ms. Lindgren, and Mr. Twain, were in school while contagious. Because test results were available quickly for Jimmy and Johnny, and because contact tracing was rapid and effective, Fanny and Melanie were never in school while contagious. If the teacher's lounge had been closed per guidance, Mr. Twain wouldn't have been exposed. If a sign-in sheet had been available, Mr. Twain would have known to quarantine before he became contagious. Either way, he would not have had the opportunity to potentially infect others at the school. The contact tracing team will have to work extra hard to trace down all of Mr. Twain's new contacts. We are managing COVID-19 in Vermont because a lot of individuals are making thoughtful choices like these to protect themselves and others. This same strategy will work in our schools. It is important for everyone to follow best practices and directives, especially including directives about isolation if they are infected and quarantine if they are a close contact of someone who is infected or if they have traveled to a high-risk area. Following these best practices doesn't mean there will not be any cases, but it does mean that working together we can contain the spread and protect the vulnerable. On Friday, November 20th, after 28 days with no additional cases associated with the school, the outbreak at Shel Silverstein Elementary officially ends. The 2 Jones boys and 4 of their close contacts, 2 children, 1 teacher, and 1 parent and carpool driver, have tested positive for COVID-19. The Jones boys' mother and elder brother were also infected. 1 additional contact was infected by the 3rd grade teacher at school and, because of a missed opportunity, did not know to quarantine. As a result, he attended school for 2 to 3 days while contagious. But fortunately, Mr. Twain and his contacts had been careful to follow public health guidelines, social distancing, hand washing, masks, and no further infections occurred at school. 3 additional cases were identified in the families of the contacts, but since they were in quarantine, no one else has been at school or at work while infectious. All cases have been interviewed, all close contacts identified and notified, and all are quarantined and undergoing symptom monitoring. Hot wash and concluding comments. Here are a few final questions to consider. What is your school doing well to prevent an outbreak of COVID-19 among students and staff? What would you like to improve? Is your school prepared to manage an infectious case of COVID-19 at school? And what help do you need to prevent and to prepare for an outbreak? Thank you for participating in this desktop exercise on a COVID-19 outbreak in a school setting. If you have any questions about this exercise, or if there is anything that we can do to help you prepare, please contact us. Links to key resources are available on the next slide. We know that you have been preparing for months. You have the systems in place to prevent outbreaks and to manage them if and when they occur. And you are not alone. All of us here at the Department of Health are here to help. Thanks for all of the work that you do each day and every day to support schools and families in Vermont.